Foot health, an important aspect of a child's growth and development, should begin early. According to experts, children's feet grow and change rapidly during their first year, reaching almost half their adult foot size. That's why it's important for parents to pay close attention to the little one's feet to ensure proper growth during every stage of development.
Foot health in children is very important. If you don't get it right at the tender age, you will never be able to deal with the foot problems later on in life.
The first few years of a child's life are crucial. During this period, the baby's feet contains more flesh and cartilage than bones. These make it more fragile and susceptible to malformation. It is important for parents to make sure that the clothes, socks, soft booties, and bedclothes you put on your baby are loose and don't compress the feet and toes. The baby must be able to move the legs around easily.
If proper foot care is not maintained or exercised or managed throughout that tender age, then what will happen is as they start to wear shoes, different type of shoes, they will develop deformity.
According to pediatricians, a baby's foot perspires twice the rate of an adult's, so you must only use socks and shoes that can absorb sweat.
Unless you're born with some degree of deformity, most of the foot problems out there are acquired, and they're caused by faulty footwear.
The surgical chiropodist says the longer a child is allowed to walk without shoes, the better.
When your toddler starts learning to walk indoors, let her walk barefoot if the floor is clean and safe. This allows the feet to develop naturally without any restrictions. When the baby can take a few steps confidently and is able to walk outdoors on rough surfaces, protect his or her feet with shoes. It must be made of flexible, lightweight, and natural material, such as soft leather with flexible soles and non-skid bottoms. Check the shoes every 6 to 8 weeks because children's feet grow on average 2 full sizes a year until they are 4 or 5 years old.
It is always a joy for parents to see their child walking, but it is not healthy to force a child to walk before he or she is able to do so.
According to chiropodists, the belief that a child should start walking at exactly 9 months is not true. It is a dangerous habit that must be stopped.
You have between 9 months to 18 months. So you should never force them to. They should develop naturally. So parents out there, please, if your child is 10 months old and he or she is not walking, it does not say that a child is not going to walk.
Forcing your child to walk before time could lead to complications.
You are going to be putting a lot of stress and strain on the muscle. And by so doing, you may, you are interrupting the integrity of the development of the muscles and so on.
Common developmental disorders that may affect babies' feet include clubfoot, a foot deformity that affects the shape of one or both feet, making them bend inwards. Flat feet. Many babies naturally appear flat-footed. It usually disappears as the baby begins to stand and walk. However, if children have flat feet by the age of 3, you must see a doctor who specializes in children foot care. In-toeing and out-toeing. Some toddlers walk with their feet turning inwards or outwards, but in most cases correct themselves as the child becomes more confident on his or her feet.
Doctors advise that if the problem persists or worsens, especially if it seems to affect only one foot, talk to a specialist. There could be an underlying developmental problem.
Remember, your children will depend on their feet to get them where they need to go for the rest of their lives. So try to observe these rules of good foot health. Replace shoes with a larger size as soon as you discover that your child's feet have started to grow. Teach children to toe straight when walking. Toeing in or out weakens the feet and throws the entire body out of alignment. When wearing socks or stockings, have them a 1/4 inch longer than the longest toe in a standing position. Wash the feet daily in warm soapy water. Cut toenails straight across. Don't bend around the corners. Keep children's shoes clean at all times. Provide a good nutritious diet and teach children to practice daily hygiene to guard against athlete's foot.
Remember, if you find signs of deformity or infection in your baby's feet, seek professional care as early as possible. Do not attempt treatment without professional advice.
For further information on foot health in children, visit your doctor or any government health institution close to you.